You need to watch this if you struggle with premature ejaculation. Are you frustrated by premature ejaculation and don't know where to turn? Premature ejaculation might sound like a punchline, but for many, it's a real issue. It's the most common sexual dysfunction in men under 40. Despite its prevalence, many suffer in silence. Understanding PE is the first step towards managing it. By discussing it openly, we can break the stigma and provide support. This knowledge can significantly improve one's well-being. Premature ejaculation has varied and complex causes. Anxiety, stress, and relationship issues play significant roles. The pressure to perform can trigger a cycle of anxiety and PE. Hormonal imbalances and abnormal neurotransmitter levels contribute. Some men have heightened genital sensitivity. Understanding biological factors is crucial. Mental state and biology often interplay. A multifaceted approach to treatment is most effective. Recognizing the source is the first step in overcoming PE. Premature ejaculation is primarily recognized by one glaring symptom: ejaculation that occurs very soon after sexual activity begins, often within a minute or less. This can happen before or shortly after penetration, leaving both partners dissatisfied. However, the issue extends beyond just timing. Another critical aspect of PE is the lack of control over ejaculation. Many men report feeling that they have little to no control over when they ejaculate during sexual activity, which can lead to significant distress and frustration. This feeling of helplessness can be a major clue that PE is an issue. Furthermore, PE often causes significant emotional distress. It can lead to avoidance of sexual intimacy, strained relationships, and a decrease in personal and relational satisfaction. Recognizing these symptoms is crucial because they highlight the broader impacts of PE on a person's life. Understanding and identifying these symptoms early can lead to more effective management. It's not just about recognizing what happens during sex, but also understanding the emotional and relational fallout that can occur. Early recognition can help prevent the cycle of anxiety and frustration that often accompanies PE. Treating premature ejaculation involves a spectrum of strategies, from psychological counseling to medical interventions. Behavioral techniques are often the first line of defense. These include methods like the stop-start or squeeze technique, which help men learn to control their ejaculatory reflexes during sexual activity. Dr. James counseling plays a dual role. It helps manage the psychological aspects of PE, such as anxiety and relationship issues, and also educates about the biological aspects. This dual approach can be particularly effective in cases where psychological stress triggers the condition. Medications are another cornerstone of PE treatment. Certain antidepressants, like those in the SSRI family, can be effective because they help to delay ejaculation. However, these should always be used under the guidance of a healthcare provider due to potential side effects. Lastly, pelvic floor exercises have shown promise in managing PE. These exercises help strengthen the muscles involved in ejaculation, thus providing better control. Combining these physical exercises with counseling or medication can provide a comprehensive approach to managing the condition. Listen to this personal story: John's journey with premature ejaculation.
I'm John, a 35-year-old graphic designer. I first noticed my struggle with premature ejaculation during my late 20s. It began affecting my relationship with my partner, leading to frustration and a lack of intimacy. Initially, I was embarrassed and avoided discussing the issue, which, well, only compounded the problem. With encouragement from my partner, I decided to seek help.
John started with counseling, where he explored the psychological roots of his anxiety around performance. This was a revelation for him, as he began to understand how his anxiety was directly affecting his sexual health.
I also explored medical treatment options. After consulting with a healthcare provider, I started a low-dose SSRI medication. Alongside, I practiced pelvic floor exercises and used behavioral techniques like the squeeze method during intimacy. These approaches combined to give me greater control and reduced my anxiety.
John's story is a testament to the importance of seeking help and the effectiveness of a combined approach to managing PE. His journey from embarrassment to empowerment not only improved his sexual health, but also strengthened his relationship with his partner. John's experience highlights that with the right support and interventions, overcoming PE is entirely possible. With that out of the way, let's debunk some common misconceptions.
Premature ejaculation is surrounded by myths and misconceptions that can hinder effective treatment and support. One common myth is that PE is entirely a psychological problem and can be overcome simply by relaxing. While psychological factors do play a role, as we've seen, biological factors are.
Another widespread belief is that PE affects only young, inexperienced men. In reality, PE can affect men of all ages and levels of sexual experience. This misconception can prevent older men from seeking the help they need, under the false assumption that it's a young man's issue.
Additionally, there's a myth that PE can't be treated. This is far from the truth. As outlined in previous sections, there are multiple effective treatments available, ranging from behavioral techniques to medication. Believing that PE is untreatable can discourage men from seeking help and accessing these life-changing.
Addressing these myths is crucial not just for individuals dealing with PE, but for society at large. By debunking these misconceptions, we can foster a more informed and supportive environment that encourages individuals to seek help and discuss their experiences openly. Time to chill out, lightening the mood with Analogy and Wit. Discussing premature ejaculation can be heavy, so let's lighten the mood with a bit of humor.
Think of PE like being in a too-fast sports car. It's thrilling but over before you really get to enjoy the ride. Or consider it like sneezing. It happens suddenly, without much warning, and there's not a lot you can do once it starts.
Using humor can make the topic more approachable and less daunting. It's like adding a spoonful of sugar to help the medicine go down.
This playful approach can help individuals feel more comfortable discussing and dealing with PE, reducing the stigma and embarrassment that often surrounds it.
But let's not forget the serious side. While humor is a great tool for engagement, it's important to balance it with accurate information and supportive.
By intertwining lightheartedness with sincerity, we can create a welcoming space for individuals to learn and talk about PE without feeling overwhelmed or embarrassed.
Wrapping up the essentials. In wrapping up, it's clear that premature ejaculation is a complex issue with a range of causes and symptoms. Understanding these can help in managing the condition more effectively. We've explored psychological and biological causes, recognized symptoms beyond just the timing of ejaculation, and reviewed a variety of treatments that offer hope and help. Revisiting John's story, we see the power of seeking help and the effectiveness of a comprehensive treatment approach. His experience underscores the importance of addressing both the psychological and physical aspects of PE. It's crucial to remember that PE is a common and treatable condition. With the right information and support, individuals can manage their symptoms and lead satisfying sexual lives. This guide aims to empower those affected by PE to seek the help they need and to encourage a more open dialogue about sexual health. Time to chip in your own contribution and share your own story and journey so far. Now that we've unpacked the topic of premature ejaculation, it's your turn to join the conversation.
Have you or someone you know dealt with PE? What strategies or treatments have you found effective? Sharing your experiences can provide valuable insights and support to others in similar situations.
Engaging with this topic not only helps in personal healing but also builds a community of support and understanding.
By sharing our stories and solutions, we can help each other navigate the challenges of PE and promote a healthier, more informed approach to sexual well-being.
Your voice matters in this discussion, whether it's through comments, forums, or social media. Your participation can make a significant difference.
Let's keep the conversation going and continue to support each and every person affected by this condition.
Encouraging professional consultation and awareness. If you or someone you know is struggling with premature ejaculation, it's important to remember that help is available.
Consulting with a healthcare professional can provide personalized advice and treatment options tailored to individual needs. Don't let embarrassment or misinformation hold you back from seeking the support you deserve.
Raising awareness about PE is equally important. By educating ourselves and others, we can break down the barriers of stigma and misunderstanding that often surround this condition.
Sharing articles like this, discussing it in community spaces, or even bringing it up in personal conversations can contribute to a broader understanding and acceptance.
Taking action, whether by seeking personal help or promoting awareness, is a crucial step towards managing premature ejaculation effectively and compassionately.
Let's make sexual health a priority, not a taboo, and ensure that everyone has access to the support and information they need.
That will be all, folks, on this episode of Premature Ejaculation, and thanks for tuning in to Health Guy's Guide. Your health matters. Remember to subscribe so as not to miss out. In our next video, we'll be diving into the cause and treatment of yet another common problem in the men's world. Stay tuned.